Hi, this is Jessica DaMassa with WTF Health, and I'm here with Anna Lorenz. She is the Global Innovation Manager at Bayer, and specifically working on the G4A program, which is the innovation arm focused on digital health. So hi, good to talk to you.
Hi, thank you for having me.
We love our friends at G4A. So tell me what's going on, because there's been a lot of changes recently, so give me an update.
Sure. So one of the newest programs that we launched beginning of the year is our first US startup collaboration program. It's called G4A Generator. It's also the first one where we focused on consumer health and enabling consumers to take better care of themselves. So it was all under the umbrella of self-care. We closed for applications in March, and we are just going through the final reviews and everything. Our final pitch event is in New York City, May 24th. So we hope to pick our 4 winners for each challenge area and continue. That said, our 2 global programs, our accelerator and our deal maker, both are just opened, or both have just opened for applications in that space.
Oh, fantastic. So if somebody wants to apply for those real quick, where do they go?
G4A.health.
Oh, fantastic. That's fantastic. So, okay, so tell me a little bit about what you're looking for, I guess, in both of those, in your deal maker and your accelerator program, because I've had this complex innovation ecosystem explained to me by the man himself, Eugene Burakovich, but not everybody gets that lucky. So tell me about the 3 different areas now that G4A is focused on.
Sure. So first, the 2 programs. So accelerator is looking for, it's more of a typical incubator accelerator concept for 100 days. You get collaboration space in Berlin, some funding, mentoring, coaching, et cetera. So it looks more for the early stage startups. Okay. Whereas our deal maker is the program for more mature startups, where it's more of a fast track to a project deal. Okay. Based on actual outlined challenge areas. They're all on the website, so you can look it up there. And then we tie them together and hopefully are able to generate a project deal much quicker than usually. That said, so G4A is our whole digital health pillar, so we actually cover 3 pillars. We have an intelligence team, we have the startup collaboration teams, so the accelerator and co, and then we have also a ventures team.
Okay. And now, I mean, I know being where you are in this whole healthcare ecosystem, there are definitely a lot of companies out there with new solutions that want to partner with you guys one way or the other. Is there any good advice that you have for them about what you look for? I mean, just I guess generally speaking in terms of a partner coming out of the digital health startup scene.
Absolutely. So I think number 1 tip I would always give is we outlined with a lot of effort in workshops with our teams these challenge areas. So those are really the pain points they have right now.
Focus on the challenge areas.
Exactly.
That's the question being asked.
Exactly. And that's also your go-to to understand what is it they're looking for and how are they we actually give some hints. So for example, for our generator here in the US, we had, for example, one of the challenge areas was nutrition support. We didn't just say, okay, this is our challenge, this is what we're looking for, this is what we can't solve ourselves. We also outlined, and these are the types of solutions we're looking for. So that, I think, was a really good basis to work off.
Do you find a lot of startup companies try to fit themselves into a round peg in a square hole, or do you think that mostly they kind of abide by the prompt?
Half and half, I would say.
Okay.
So some go about it very broadly. One of the challenge areas was, for example, self-care, and you notice that you could almost everything can be applied to self-care. Others have a very specific focus, which is great, but then it also just spoke to a very limited amount of the challenge, and I think again, they're look at the challenge. That's kind of my advice, and figure out what is that where is that sweet spot of a collaboration? What does that look like?
So, Anna, I love to talk to innovation people anywhere, because especially in healthcare, because I feel like you guys go to a lot of conferences, you talk to a lot of startups, you talk to a lot of of your peers who are big medical, pharmaceutical, healthcare companies, and it's you guys get a good sense of what's going on. Mm-hmm. So I want to know what has you excited lately on the healthcare innovation scene, either within or without pharma? What are you excited about?
I think most excited. What gets me most excited is we've been talking about a lot of things, and we're finally at this point where we actually have actionable results. We started to implement and see, and we have, especially on the data side, we finally have the data that we need to actually move on certain things. And certainly we as a big company and the pharma company have a long way to go in that area, but I think we're starting to at least move, and that excites me.
I'm curious to know from your perspective, as a pharmaceutical company, I mean, Bayer's been around forever, but it's like this foray into the digital health space is kind of new, and you're looking for things to wrap around pharmaceuticals, wrap around medications. So why should pharma be in this space doing this instead of there's like a million little startup companies that are already doing this, but why should that be something that pharma owns that space as well?
So I think there's multiple reasons for that. One of them, a lot of the solutions are beyond the pill, but they still require the pill itself, and that's our business. And secondly, we've this experience and the infrastructure and the global footprint to actually scale some of these things. So I think that's how one of those things. What I love about the startup programs is we can bring these innovative new solutions to actually scale and bring more value to patients and consumers around the world.
All right, last question for you, because I ask everybody. WTF Health, so what's the future? So what's the future in this space? And specifically, I want to know, what do you think is next? Are startups and big pharma companies, beyond the pill has been around for a while. Are we beyond the pill now and looking at something else? Or what do you think? You said these solutions are finally starting to get hold, but what do you think is next?
Well, my wish for the future would be.
I wish wish the future.
Yeah,
that's
I know.
The new WTF.
I'll go look back at this in a few years and say, did that work out? So my wish would be that we all collaborate more, that we open up, that we actually notice how much value there is in all this ecosystem and all the activities that are happening quite in parallel right now.
Yeah.
So more of the connection among all the companies and the data points, et cetera, et cetera. And I think in that we'll automatically have a better focus on the patient and the consumer and build solutions around them. And beyond the pill, yes, I hope we'll move forward. We should always move forward. And also digital health, maybe in a few years it's old news and we'll continue. So, but we should never leave out the human factor and who we're actually building this for.
And it was so good to talk to you. Thank you so much for taking the time to speak with me. Appreciate it. This is Jessica DaMassa with Anna Lorenz from Bayer. Thanks so much for joining us.